Cranial nerves are a set of 12 nerves that originate directly from the brain. They help control everything from our facial expressions to our ability to taste, see, hear, and smell. Each cranial nerve has a specific role. Some nerves bring sensory information from the organs to the brain, while others control muscle movements or gland secretions. Understanding cranial nerves is key to understanding how our body communicates with the brain. They serve as pathways that transmit information quickly and efficiently. When these nerves function properly, our body can react to stimuli and perform functions smoothly. However, when there is an issue with these nerves, such as a lesion, it can cause significant problems. This is why it is important to understand the roots, locations, and potential issues that can affect cranial nerves. Cranial nerves are numbered based on their location from the front to the back of the brain. The first nerve, known as the olfactory nerve, is responsible for the sense of smell. The optic nerve, the second nerve, is crucial for vision. The third nerve, the oculomotor nerve, controls most of the eye muscles. The fourth nerve, called the trochlear nerve, also helps with eye movement. The trigeminal nerve, the fifth cranial nerve, is the largest and is responsible for facial sensations and chewing. The sixth nerve, the abducens nerve, controls lateral eye movement. The facial nerve, seventh, controls facial expressions and taste sensations. The eighth nerve, the vestibulocochlear, is involved in hearing and balance. The ninth nerve, the glossopharyngeal, has roles in taste and swallowing. The 10th nerve, the vagus nerve, influences heart rate and digestion. The 11th nerve, the accessory nerve, controls shoulder and neck muscles. Finally, the 12th nerve, the hypoglossal, manages tongue movements. A nerve lesion refers to damage or injury to a nerve. This can disrupt the normal function of the nerve, leading to a range of problems. Lesions can occur anywhere along the nerve pathway and can affect a single nerve or multiple nerves. They can be caused by various factors, including trauma, disease, or infection. The significance of a nerve lesion depends on which nerve is affected and the severity of the damage. For example, a lesion in the optic nerve can lead to vision problems, while a lesion in the facial nerve might result in facial weakness or paralysis. Nerve lesions can be temporary or permanent. Temporary lesions might heal over time with proper treatment, while permanent lesions can cause lasting damage. Early intervention can lead to better outcomes and improved quality of life. Cranial nerve lesions can be caused by a variety of factors. Common causes include traumatic injuries, such as head injuries or surgical complications. Diseases like multiple sclerosis, diabetes, and infections like meningitis can also lead to lesions. Tumors or growths pressing on the nerves can cause similar issues. Each cranial nerve lesion presents with specific symptoms. For example, an olfactory nerve lesion may result in a loss of smell. An optic nerve lesion can cause vision loss or disturbances. Lesions in the oculomotor, trochlear, or abducens nerves can lead to problems with eye movement and double vision. A trigeminal nerve lesion might cause facial pain or loss of sensation. Facial nerve lesions often result in weakness or paralysis of facial muscles, affecting expressions. Vestibulocochlear nerve lesions can lead to hearing loss or balance problems. Recognizing these symptoms early can lead to prompt diagnosis and treatment, reducing the risk of long-term complications. Treating cranial nerve lesions depends on the underlying cause and severity of the lesion. Treatment aims to relieve symptoms and restore nerve function. Medications such as anti-inflammatory drugs or steroids can reduce swelling and inflammation around the nerve. In cases of infection, antibiotics or antiviral medications may be necessary. Physical therapy can help improve muscle strength and coordination, especially in cases involving motor nerve lesions. Surgery might be required to remove tumors or relieve pressure on the nerve. In severe cases, nerve grafts or reconstructive surgery can be options to repair damaged nerves. Investigations to diagnose cranial nerve lesions include imaging tests like MRI or CT scans. These provide detailed images of the brain and nerve pathways. Electromyography, or EMG, and nerve conduction studies can assess the electrical activity in the nerves and muscles. Early diagnosis and intervention are crucial for better outcomes. With appropriate care, many individuals can recover from cranial nerve lesions and regain normal function.